And we'll fast forward that. Or not.
Hi, everybody. I'm Tara Novak. I am the program and chair of the Vet Tech program here at the Mount. I have my certification. I'm a CVT, which is a certified veterinary technician here in the state of Massachusetts. I also have my laboratory animal technologist certification, which is a certification you can get working in laboratory animal field, which I did for a while. So our program here is awesome. It's a 2-year program. Once you finish your degree here, you are qualified to sit for the national exam, which is the Veterinary Technician National Exam, or the VTNE. And once you pass that, depending on what state you live in, is different types of licensure certification. So in Massachusetts, you can sit for the exam, and if you pass, you are a certified veterinary technician. You're going to get hands-on skills. You're going to work with dogs. You're going to work with cats. You're going to work with rats. You're going to work with rabbits, mice, birds, goats, pigs, horses. We pretty much try to get you experience with most of the most common species that you're going to see out there. A lot of times we also give you an internship where you go out and you get practice at a real vet clinic. Our program is very well-rounded. We have great staff and faculty that'll work with you. Some schools, you're going to sit in a class with 100 people. Here, we take no more than 24 at a time. So it's a great program. You know, you can't come into veterinary medicine of any kind and expect it to be easy and that you're just going to, cuddle with puppies and kittens. So you do need to realize that it is a competitive program. So a little bit about where you're going to learn. And so this is the major classroom where you're going to do all of your lectures. So, you can see up at the front, and then we have benches and all kinds of hands-on stuff in this room.
Are you kidding me? Sorry, guys.
You're needed right now. You'll be. But most of your lectures, and then we have benches and all kinds of hands-on stuff in this room. But most of your lectures are going to be here. And behind us is a mock surgery room. So we have an anesthesia down the hall from here. It's brand new. It's beautiful. And it's got all the specimens and anatomy things that you need to do. And then we actually have a clinic that's kind of across the street from here that allows us to come in and do our hands-on labs in there. So when you're learning how to restrain or do a physical exam, you'll be over there. They do our surgery labs. So anytime when you're in the surgery class for the lab, you're going to be over there with the actual doctor in the actual room. You're not doing the surgery, but you're participating. You're going to be handing the doctor their tools when they ask for them. You're going to be monitoring anesthesia. So you're right in the thick of things. So there is a demand right now, and there will be one in the future. So it is a good career to get into because you're going to be needed. You're needed right now, and they're going to need it even more in the future as it grows. So in veterinary medicine, you can't be replaced by a machine, right? Because machine can't do what we do. So it's a job that's always going to be there. And whether you're the guy that's the animal assistant that is walking the dog, cleaning the dog, feeding the dog, the vet tech who's doing the care, or the veterinarian who's doing all the diagnosing and the surgeries, you're needed, and that job is going to be out there, and it's going to continue to grow. I love learning, and this is one of those fields where you're constantly learning. Like, I might know something 2 days ago, and tomorrow it's something different. And just being able to keep that constant knowledge going. So between the animals and just learning, I love to learn. And those are the two things that make me like this field so much. Let's talk about some really good things about being a vet tech or in the veterinary field at all. You do have fun because you work with your coworkers so closely, and you got to have fun, right? You can't just be serious all the time. So having fun. One of the other great things is when you're the one who walks out and hands that pet back to the owner that's healthy, happy, and can go home. That's that's the biggest reward, right? Is knowing that you were part of that care and now they're home with their owner and they're happy. You're always teaching, even if you don't think you are, because you're teaching the owners, right? Part of the job in the veterinary business is client education, right? They're not going to know what they're supposed to do if you don't help them and teach them. So teaching clients, experienced techs are going to be teaching the new guys, right? I went back into teaching because I like to teach. I don't work in a clinic anymore. My focus now is teaching the next group of vet techs to go out there and be the best they can be. You're probably wondering what kind of money or salary you would get working in this field. So a vet tech, I'm gonna stick with that because that's my profession. coming out of school, probably between $15 to $17 an hour. And I know that doesn't sound like a lot, but the more you're experienced, the more you make. In a few years with experience, you can make double that. Depends on what field you're in. Big hospitals obviously are going to pay a little bit more than your small clinics. People who are interested in research, you can make a lot more money doing that, because you need to be knowledgeable, you need to be responsible, you need to be trustworthy. So they're looking for that kind of a person. But like I said, it's a passion, right? We don't really care as long as we can make a living and pay for what we need. That's why we do this job. So a lot of people are like, oh, I'm not going to make a living on this. This isn't what, maybe I should do it. Just if this is what you want, don't worry about that number figure, because it will change. It's not going to be the $15 to $17 an hour. That's just to start. And if you prove yourself, that starts going up really quickly.
Hi, my name is Hillary Blair. I am an adjunct professor here at Mount Wachusett Community College. I teach clinical nursing and radiology for the Mount. And then outside of the Mount, I also work in clinical practice at Angel Animal Medical Center as an emergency and critical care technician. So general practice is focused more on wellness care, and emergency and critical care practices focus on those illnesses, accidents, traumas, all of those things that just like people get, animals get too. So it's very similar. So all the things that you would see in a human ER, you will see in a veterinary ER. We are in Mount Wachusett Community College classroom for veterinary technology. So this is where we do a lot of our lectures, and then also we do a fair amount of our clinical nursing labs in this room as well, just to kind of start getting used to doing some of the skills that we learn. And then as the class advances, we start to practice on live animals. We have a really cool thing called a Sindaver. So it's like a fake canine cadaver.
When Hillary's using her for her classes, she can show them how to draw blood on this before she goes and gives them a live animal to practice on. So Hillary helps build their confidence up so that they can do it on a live animal first.
So this is called a syringe with a needle attached. And then I also have an IV catheter with a T-set. So we connect this to the catheter, and that's enables us to push IV fluids through the catheter or give medications intravenously without having to poke them over and over again. There's several common places that we draw blood from in a dog. We use the jugular veins pretty often. So they're on either side of the neck up here. So the trachea runs here, and then the jugular veins are on either side. These ones are called the cephalic veins. These are probably the most common ones used because they're the easiest to access and the easiest to actually hit because they don't move around very much. So when I have someone, when I'm drawing blood, there's usually someone holding off the vessel. And then sometimes you can see it, sometimes you can't. But you want to palpate, and it feels like a little rubber hose underneath the skin. And to do it, you just kind of go at about a 45-degree angle, insert into the vessel, and then aspirate your blood. And then you want to remove the needle and hold pressure at the site where the blood was drawn from so that they don't continue to bleed under the skin. When placing an IV catheter, very similar procedure, except we leave something behind after we poke. So I don't know if you can see, there is a catheter here. So this is what stays inside. And then the needle is what we use to kind of get through the skin and the vessel. So the catheter sits over the stylet. So I'm gonna, again, same thing, someone holds off the vessel, go in, and then you only go in a little bit, and then you advance the catheter into the vessel, remove the stylet, and then you attach your T-set so that it doesn't keep bleeding. And then secure it to the leg so it can't fall out. Typically we use tape and then cover it so that it doesn't get dirty, and then also just to protect it. So then we secure this to the catheter, and this can stay in for, I've seen a peripheral catheter last like 7 days. So it just kind of depends on the situation. Sometimes they don't last as long for various reasons. There are longer term catheters that you can place, but this is kind of one of the most common skills that veterinary technicians do is phlebotomy, but then also placing intravenous catheters. So much of veterinary technology is just repetition, especially with the skills. It's practicing over and over and over again. I tell all of my students, like, I was not good at phlebotomy when I first started. I was terrible, but I practiced and I practiced and I practiced. Being squeamish and being in this field can happen. There are definitely people that have their things that they just can't deal with. I know personally, I can't not handle maggots. I know about, and I make somebody else do it.
Maggots and eyeballs.
So eyeballs. A lot of people can't handle eyeballs, but the great thing about veterinary technology is there's such a huge range of things that you can do that you can avoid the thing that you're squeamish about. Hard to avoid blood to a degree. So if you're squeamish about blood, maybe not the best choice for you. But I know a lot of people that are squeamish about drool, drool.
I know somebody like that.
Unfortunately, poop is very much a part of this job. Vomit, if you don't like vomit, don't get into veterinary medicine because you're going to spend time fishing through it looking for fun random objects. I think the weirdest thing we've had come out is an entire dead rat that I've seen. Dog swallowed it whole like a snake and they brought it back to vomit.
But there are other things that you can do. You can work in a grooming salon, right? Grooming, there's no medical part to that, right?
Social workers, there's been a lot of social workers that have started entering veterinary medicine to kind of help people get through those really difficult moments of pet ownership, especially in regards to death. So social worker for a veterinary hospital is definitely a career choice for you. You're still helping animals, you're still helping people. It's just maybe not direct patient care.
Dogs that are going to be trained for veterans or special needs dogs or service dogs. Working with them, that's such a wonderful, fulfilling career because you know that you're training these animals to go help somebody else out in life.
So yeah, training is definitely a thing that you could definitely do. Physical rehab is huge now. It's a booming aspect of veterinary medicine and very, very small chance of blood and smelly things.
Some of the other things, massage is a huge industry, especially in the equine world. You can get acupuncture, equine massage, or even, all animals massage, different kinds of therapies. You could work for pharmaceutical companies or nutraceutical companies where you're going to go to these clinics. And so you're still involved in the pet care, but you're more of helping sell or, provide the medications and the supplements that the animals might need.
So what I'm going to show you now is just some kind of quick basic first aid that you can do on your cat or dog if they ever get injured at home or if you're out hiking or anything like that. Things to remember is when their animals are injured, they're not going to hear you when you say, it's okay, I'm not going to hurt you. They're injured. They're going to react and they might try and bite you. So especially for dogs that are extremely painful, what you can do if they are trying to bite you is you can create an emergency muzzle. So what you're going to do to create an emergency muzzle is you're going to take a long strip like this. You're going to make a loop it under so it's like this. You can see, and then you're just going to kind of quickly put it over the muzzle and you're going to tighten down really quickly. And it seems like it might hurt the animal, but it's not. So what this does is it stops them from opening their mouth to bite you so that you can then provide first aid for whatever injury that they have so that you're not getting hurt and they're not continuing to get hurt. So once you loop it up around behind the head, just tie a bow in the back. Okay, so now your pet is secure so that you can maybe treat whatever is hurting them. If this might be a broken leg, they might have a big wound in their foot or on their side or anything like that. Like I said, animals are not going to listen to you when you talk sweet to them when they're hurt. They're just going to react. So now that we have a nice muzzle on our friend here, I'm going to ask Tara to come here for a moment. And she's going to just kind of help hold this little dude up. Pets, especially dogs, especially Labrador retrievers like this one and mine, are not the brightest of creatures and they like to run into things. And sometimes they stab themselves with sticks or they fall or they hurt themselves and they get a big wound somewhere. So what you want to do if they have a wound, before you get to the vet, you want to cover it up so it doesn't keep getting dirty, so it doesn't bleed everywhere. And also if it's in the chest, it kind of helps protect the chest because there are risks associated with that. So say he has an injury right here, and you can use a bandage to kind of like help cover the wound and just make sure you go up around in front of the legs just so that the bandage doesn't slip down the body because the chest is a lot wider than the abdomen. So if you don't have that anchor around the front of the chest, it's just going to slide right off. You're going to take your gauze and you're just going to kind of roll up and around, and you want to kind of loop it up between the legs because it's going to stop it from sliding down. You're just going to kind of cover up that wound really quickly. You want to make sure it's just rolling gently. You're not trying to tighten it. If you make it too tight, they can't breathe, which is bad. So once you have that covered, this is something called vet wrap, handy to have in your home first aid kit. And again, you wanna, before you apply it, loosen it off the roll and then re-roll it. Because it's kind of tight to the roll and you might accidentally make the bandage too tight. But it's a very loose and gentle covering just to kind of keep the wound from getting any dirtier. If you don't have this material, then you don't have this material and you should just seek veterinary care immediately. But you really want to kind of stop the wound from getting any dirtier. And that's probably the most important thing. So once you're done and your pet's bandage, it's in the car, you guys are ready to go to the vet, take the muzzle off. And it just pops right off and they can pant and stuff like that. For legs, the same thing. You kind of just want to be loose and gentle with your bandaging. And it's not, you always start at the bottom and you work your way up, covering whatever wound might be there. And then you always end at the bottom. And then kind of cover it with that vet wrap again, just to kind of help keep it secure so that it doesn't get dirty, especially when it's on the bottom of their feet, they like walking things. If you have like a small dog or a cat that's injured, and they're probably not gonna let you bandage it, I wouldn't stress too hard about it, but cats when they're injured are crazy. They got flying weapons everywhere. They're trying to eat you, even though they're 5 pounds. So the best tool you can have for a cat that's injured that you need to pick up is a towel. Just throw the towel over the cat, scoop it up. Cat's angry, but at least this way you control the legs. You can uncover their face, so just their little faces poking out, you know that they're breathing and they're okay. It's also a great tool for small dogs. Small dogs are a little bit harder to kind of get the gauze muzzle on because it's a smaller target. Again, towels, blankets are your best friend. Throw it over the pet, scoop them up. And it's kind of a nice, quick and easy way to kind of pick them up, get to the car, get them to the vet. So this is a pet first aid kit that you can get. A lot of different companies manufacture them. This one is met by Pet Emergency Education. And inside it has a lot of really kind of useful things. There are things you can think about if you want to build your own, if you don't want to buy a pre-made one. A thermometer, this is useful to check the temperature of your pet. So especially during the summer months, dogs can very easily get overheated and it can become very dangerous. So being able to check their temperature to make sure they're not too hot is definitely important. There's bandaging material in here, bandage scissors, lots of different bandaging materials, tweezers, and then there's also an ice pack. If they're too hot, you need to cool them down. An emergency blanket if they're too cold and you need to warm them up. So like pets that fall in through thin ice, this is a great way to help reflect their body heat back to them. There's an emergency leash, an emergency bowl, all different kind of things to kind of keep in mind. For this profession, you need to have a passion to care for animals, but you also need to build those skills to be able to do that. But another thing that a lot of people forget about sometimes is that these pets are attached to people. So you have to be able to communicate with these pets owners to be able to help the pet. You are going to use math in this field. I know everyone says, I'm never going to use algebra again. Yes, you are. Algebra is definitely something you use a fair amount as a doctor, as a nurse, to be able to do those calculations to give those pets appropriate medications. I think that math is the most applicable. Reading comprehension is important. Legible handwriting, super important. It never hurts to read. Building a vocabulary, reading different science books, different reading. You can read about biology, read about anatomy and physiology. All of these things can help you in this career path to understand how the body systems work. And a lot of what happens with humans is somewhat similar to what happens with animals. So if you kind of understand what's going on with people, you can kind of understand what's going on with animals.
One of the things I feel that you can start on now, no matter how old you are, is effective communication, right? Being able to look somebody in the eye and have a conversation is incredibly important. In veterinary medicine, there's a client, there's a person attached to that animal. We can't go, okay, Fido, you go home and take those pills 3 times a day. You need to be able to look at the client, tell them what they need to do, and make sure they understand. For those of you who are like middle school, high school age, you're thinking about, yep, this is something I want to do. Start looking at the colleges that might interest you. Call them up, ask for a tour. Call, and every single vet tech program has a program director. So, and they should be in every single program's website directory. Look them up, email them, call them. That's what they're there for, is to answer your questions. Talk to technicians that you know, and even if you don't know, you have a pet, go to the vet clinic, talk to the technician. How did you get into this field? What did you do? Do you like it? What do you think I should do, not do? Pros, cons, talk to people, do your research. That's the most important thing I can say.
I definitely encourage you guys to find volunteer opportunities. Like I said, it's very helpful for you to kind of understand if this is the right path for you. And if you have questions, you can always reach out to your teachers, parents, people at community colleges to kind of help guide you in where you want to go.
All right, guys, again, I'm sorry about all the glitches that were happening, because everything was running fine on my end and I still can't get my camera to work. So I apologize for that too. So we have a few more minutes left. We've got plenty of time. If anybody has any questions, comments, like I said, it worked. The video was working great on my side, but Hillary was texting me, letting me know that it was getting glitchy for some people. And again, totally apologize for that. So do we have any questions that anybody wants to ask? Okay, Riley, I see your hand up.
How would you do pet what's it called? I forgot. It's when you give them breaths when they don't have them.
Oh, pet CPR.
CPR.
Yep, Hillary.
Yeah, is it the same way?
Yeah.
So pet CPR is similar. It kind of depends on the size of your pet. For big dogs, you want them on their side, not on their back. So with people, they're always on their back when you do CPR. With most dogs, especially big dogs, you want them ideally on their right side. And then you kind of push in the middle of their chest over the heart, and you want to go at about 120 beats per minute. So do you know the song Staying Alive? The disco song? So do it to that beat. And that's how fast you want to compress the chest, roughly about 1/3. There are lots of pet CPR classes that you can take out there that kind of go into a lot more detail about it. For smaller animals, you just want to kind of use your hands to kind of squeeze their chest. So like cats, small dogs, you don't want to put your full weight because then you can hurt them, but you can squeeze them like this. But like I said, there's good pet CPR classes that you can take to kind of learn more about it. There are some more things involved in it, but chest compressions are the most important thing.
Thanks.
Welcome. Any other questions?
Might have to speak up because we can't see everybody and there's 117 of you.
Yeah, so if you just want to unmute yourself one at a time.
Can ask us pretty much anything.
Yep.
You guys can also throw questions in the chat.
The chat's been disabled.
If they're in Whova, there's chat.
They have a different, yeah.
Oh, okay. I can't see that.
Hi. My name's Anna, and how many years can you be like a vet?
So to be a vet, it's a little different. I'm a technician, so I'm a veterinary nurse. So I only had to do about 2 years of school. And then I could start practicing. For veterinarians, it's about 8 years of school after high school. So you do your bachelor's degree and then you go for your advanced DVM degree. And then after that, you can go into practice if you pass all of your exams and start taking care of animals in like a general practice. But if you wanted to do an internship or if you wanted to specialize in like surgery or emergency, dermatology, any of those kind of cool specialties, you would have to do an internship and then a residency, just like with people. The residency is about 3 years. But you can also specialize as a technician as well. Technicians can get their veterinary technician specialist. So you get like extra letters at the end of your name. So there's lots of different specialties for that. Well, I'm personally specialized in emergency and critical care. I didn't have to do extra school, but I did have to work in emergency and critical care for at least 3 years. I had to do a year-long application, and then I had to sit for a very hard test.
Great. And Jerry, I see your hands up.
So I might not have heard this because it was like really laggy for me and glitched out for some of the parts.
Sorry about that.
How many like years do you think it would take a practice to like become a pro at this stuff?
So for one of us to become a pro is what you're asking?
Yes.
So after your 2 years of school, it depends. It depends on where you want to go, but within a couple of years, you're as long, and to be certified in a technician, you have to keep doing continuing education. So you never stopped learning. You have to do certain hours depending on your state. So to be a pro, it depends on what you like to do. I used to be a pro at putting in IV catheters because I did it constantly all the time. And because I did it so much, it only took me a few months to become a pro at it. So it depends on how much you practice. So it can take anywhere from a few months to a few years.
But you're always learning. So you're always getting new skills. You're always learning new things. It's an ever-growing, ever-changing profession.
Okay, thank you.
You're very welcome.
I have a question.
Yep. Is
So-
that Briella?
Yes.
Okay.
So what degrees do you need to become a vet, depending on like what kind of vet there is?
So for a vet, to be honest with you, technically you do not have to have a 4-year college degree. You have to make sure that you meet certain requirements for that vet school. But the best is to get a 4-year bachelor's degree and make sure that you take the courses. If you know there's a vet school you particularly want to go to, you want to make sure that you look at their required courses and make sure that you take those while you're in your 4 years of getting your undergrad bachelor's degree. And then after that, you would do 4 more years in your chosen vet school, or, once you get in.
There are also a lot of colleges that offer pre-vet bachelor degrees. That's a Bachelor of Science, but it's pre-vet, so it makes a lot of them make sure they cover all of those prerequisite courses to be able to enable you to get into vet school.
Okay, thank you.
Yeah, I actually know one of our adjunct professors, Dr. Newell, is a veterinarian, and she's been a veterinarian since, she was from Tufts, for one of Tufts' first graduating classes. So going back to the 80s, I think early 80s. And she just got her bachelor's degree about 4 years ago. So she never got a bachelor's degree before she went into vet school. So it is possible to do it that way too.
I see Riley raising her hand again.
What would happen if you got like three? Would you be called like would it be easier to get veterinarian jobs if you had a higher degree?
Not necessarily. If you are a veterinarian, as long as you have your DVM and you're licensed with whatever state you're working in, it's generally not hard to get a job. Hey, your camera's working, Tara.
I found the button. Okay.
It's not really hard. There are a ton of veterinarian jobs out there. It's a field that's growing quite a bit. Even for veterinary technicians, there are tons of jobs out there. Tons and tons and tons. You can pretty much work wherever you want and people will hire you. You can get hired straight into a specialty hospital directly out of school. And it's definitely, there's a big difference between veterinarians and veterinary technicians. So veterinarians do a lot of the thinking and the diagnosing and analyzing information. And it's the technicians that do a lot of the direct patient care. So the technicians are the ones that are drawing the blood, giving the medications, doing all the nursing care when they're in the hospital. That's all the technician. The doctor is kind of there to kind of assess the information that the technician is giving them.
Oh, okay. Thank you.
Mm-hmm.
And I don't think it was mentioned in the video, but for those of you who are interested in getting a job in the veterinary medicine world, the growth for that job right now in the next 10 years is going to be 18 to 20%. So they're desperate right now. They're going to be even more desperate for good quality veterinary care people, whether you're tech, an assistant, or a veterinarian. So there's going to be jobs out there in the next 10 years that, you know, we're going to need to fill. Any other questions? I'm so glad my camera worked at the last 5 minutes or so, but anything else?
I don't see any hands raised.
No, anything coming through in the
There is a question in the chat. How do you treat big animals like horses?
very carefully? No. Horses are a big part of my life, but you treat them just like you would a dog or a cat. Really, they're just bigger. Their bone structure is a little bit different. So again, knowing anatomy and different anatomy for different species is very important. And instead of, you know, claws and stuff you have to worry about, it's the teeth and hooves. But as long as you know how to work around larger animals, I've worked around cows, horses, camels, llamas, you know, and you just need to be aware of their behavior. Like they'll give you warning signals, just like a dog will growl, that's a warning sign. You know, learning body language and understanding the animals you're working on is probably the most important part of being safe and being able to work on them effectively.
But that's a lot of also what you learn in school as a technician or as a doctor. You learn how to read their body language and their behavior so that you don't get hurt, and also so you don't hurt them.
And you'd be amazed how much of a baby a horse can be about getting a teeny weeny little needle in their neck.
Little tiny drama queens and really big bodies.
Buddies, yeah. I know horses that as soon as they smell the vet, like they know they pull up in their truck and they panic. It's, yep.
Riley, can see your hand up again.
Sorry.
No, don't be sorry. Love the questions.
If you have like a fat, like for me, this is my cat Miko. He's very fat. He eats food, but he throws up a lot, and like it's not like a lot, but it's like he's fat, and I don't know if that's the reason, but he just throws up. I expect a cat too.
It's a cat thing. Some cats just puke a lot. Some cats don't. I think as long as he's acting normal, like I have 2 cats that vomit all the time, and then I have a cat that pretty much never does. So it just kind of depends on the cat. Cats just, they're weird. They like to vomit. It's just a weird cat thing, as long as he's healthy and normal. But if you're concerned, you can always, you know, talk to your veterinarian. It looks like he loves you a lot based on how many kisses he's giving you.
He's so cute.
He has very scratchy tongue, but oh, thank you.
You're very welcome.
There's another question in the chat about fish and if you can care for fish and do surgery on fish.
Yes, you can.
Absolutely. You
can. It's super cool. You basically infuse the anesthetic gas into the water because fish breathe through water. So they breathe through their gills. So they take that anesthetic gas in the water. I've personally never treated a fish. The closest I've come to that is an axolotl, which is a type of amphibian. But you can treat fish. There are people that have surgery done on their koi fish. I know there was one practice I was working at, someone was bringing in their goldfish a lot for medications and treatments. So it's, you can, you have to you need a exotic specialist to be able to treat fish. Pretty much most veterinarians have no idea what to do with them because it's such a specialized field. But there are absolutely exotic veterinarians that will treat fish. I know Angel has, I believe Dr. Sullivan definitely does at Angel. He's an avian exotic specialist, and I think the other 2 might as well. But there are avian exotic specialists out there that will treat the fish in this area.
Yeah, Tufts University has exotics vets that will treat fish also.
Yeah, I think Dr. Graham does.
I have
about
another quick question.
Sure.
So I've always been interested in psychology like all my life. So if I want to become an animal psychologist, how many years of college would that take?
Animal behavior is slightly different. You don't necessarily have to be a DVM, but I do think it's still a similar amount of college education. I can't remember exactly how much, but I think it's very similar, but you can specialize in that. And I don't think you have to be a DVM. I know someone who is an animal behaviorist and she is not a DVM, but I do believe she has a master's degree. So it might be, another about 6 to 8 years of school.
And if you wanted to be an animal behaviorist and prescribe medication, you would have to be a veterinarian because they're the only ones that can prescribe. So it depends on how far you want to go. Do you want to go to that full level where you were the one prescribing the medications if the animal needs it, or not? So that would depend, extend your or shorten your length of school.
Okay, thank you.
You're very welcome.
Christopher.
So Christopher's question was, how would you calm the horse or get it to a good way to operate on it?
So so that's two different things, right? So if we want to just calm them, if it's something that we need to do right away, you can give them medications that will help relax them and calm them. Sometimes the veterinarian will give it to the owner in advance because they know that the horse is going to behave that way and needs to be more relaxed. And then if you're going to do a surgery on a horse, they're going to be completely anesthetized. So they'll get a medication to kind of relax them, kind of sedate them so that they kind of go down. And then you have to put what's called an ET tube, and so it actually, in humans, if you've seen it, it's the one that goes down the windpipe through the mouth. In horses, they actually do go through the nose with their tubes and go into the trachea so that then they can give the gas to the horse and then perform the operation. There's a lot of heavy equipment that goes with horses to do surgery. They have almost like a crane to hoist them up, because you're not going to pick up 1,000-pound plus horse and put it on the operating table. And then when they wake up from surgery, they're actually put into a padded room so that when they try to stand up, they're going to be all wobbly and fall down. So it's a little bit different doing surgery on a big animal like that than it would be on, say a dog or a cat. Did that answer your question? And then I was going to mention over the long term, if you do have a horse that's spooky of their vet, you can actually work with it and condition it to not be afraid. And there's all kinds of things you can find online that can do it. A lot of it is clicker training. If you've seen that, works wonderful with horses. They're pretty smart and they catch on to that really quickly. So like when they do with the dolphin training with the whistle, you use a little clicker and you can train them to be not afraid of the vet so much.
So that brings us just over time at 11:01. There are some additional questions in the chat.
Okay.
Sorry, I'm trying to pull up the agenda. I want to be respectful of everyone's time, though. So
I know we started a little bit late and glitchy. So if anybody has questions.
So there's questions in the chat box. So those of you who are who need the break before the next session at 11:15, please feel free to jump out. But we'll go through a couple more questions if you two are okay with that.
Yeah, totally.
So one question that we got. Sorry, I got to scroll up. I just got a bunch of them. So one question was, how hard do you feel it is to be a vet?
Okay. It's hard. It's a very hard profession because there's so much schooling involved. There's a lot of hard schooling. It's not easy. There's also veterinarian, even though they come out with pretty much, their degree is the same as a medical doctor. Medical doctors coming out of school will get paid a lot more money than a veterinarian does. So there is that aspect that they have high tuition bills that they have to pay, and they're not getting paid as much as a regular doctor would be. So there is that aspect. So it's hard that way with finances. And it's a tough job because, the good outweighs the bad, but there's always the sad parts, right? When you can't save a patient, or it's the end of a long, great life that the vet has been involved with. You know, a lot of these vets are involved with puppies and cats and horses and everything from the day they're born to the day that they died. So that's really hard. You know, they become attached to them too. But then there's all the good stuff. Like I mentioned in the video, being able to give that patient back to the owner, healthy and can go home, just helping take care of them throughout their life, and having them, you know, knowing that you're helping take care of somebody's family member, because all of us pretty much think of our pets as family. So it's hard. I'm not gonna lie, it's a hard job, but it's a very, 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 very rewarding job.
And it's fun. We have a
Yes.
lot of fun.
Fun.
Play a lot of pranks on people.
There's another question about what the differences are between being a general vet for people's pets versus being a vet for exotic animals at a zoo.
Go ahead.
So it's a little bit different. So basically a DVM, when they come out of school, technically can treat any animal, but they may not necessarily have the right knowledge for it. So there are veterinarians, so there's zoo medicine, and then there's avian exotics clinical practice, which is a little bit different. Zoo medicine, you're treating, lions, tigers, elephants, armadillos, all of those crazy things. And you do have to, do internships and I believe a residency for it as well. Avian exotics, you're treating rabbits, guinea pigs, ferrets, a lot of exotic birds, tegus, which is a really big, it's like a monitor lizard, snakes, amphibians, kind of all of those things of pets that people keep in their house. So that's kind of a little bit of the difference between it. You can kind of do those things as technicians as well. You can work in zoo medicine, you can work in avian exotics, kind of a lot of the specialties that veterinarians have, technicians have as well.
I have a question.
Mm-hmm.
What animal do you usually get the most, or usually gets the most injured?
I don't think there's any animal that specifically gets more injured than others. I think we see mostly cats and dogs because most people have cats and dogs. Horses are just as prone to injury as cats and dogs. In
the horse world, we joke around that you can look at them and they'll hurt themselves.
Yeah. So there's no specific animal that gets hurt more than others. For exotics pets, it's usually not that they've hurt themselves. It's that maybe the people that own them are not doing the things that they need because they're so specialized that they need very special care that a lot of pet stores don't necessarily tell the people when they're getting their pet. Riley.
So what do you think is a dog or a type of animal that you've had to treat that you think it looks dangerous but has really been the sweetest? Because I have a pit bull and she looks pretty scary, but she's the best dog ever.
There's no specific animal that looks mean but could be nice, or looks nice and could be mean. They're all different, just like people. Animals are just like people. They have personalities like people. They have feelings like people, sometimes really big feelings. And it just kind of depends. Little dogs tend to be a little bit nippier, but I think it's just a defensive mechanism because they're scared and everybody's so much bigger than them. It really just kind of depends on the individual pet.
But I know what you mean, Riley, meaning that, a lot of people might be afraid of your dog because of what they look like, right? Yep. And when I worked at Tufts, and that was the thing, it's all those big dogs that people were, afraid of, like the Rottweilers and the Pit Bulls and the Boxers, and those were the biggest love bugs that we had. It was the little land sharks, as I call them, that were the ones that you were, people think, oh, it's a cute little pupper. I'm like, well, watch out for that cute little pupper, right? So, yep, you can't go by their looks. You got to take, like Hillary said, take their personalities. They all have their own unique personalities.
Great. We have 2 more questions, and I
Sure.
think we'll push everyone off to
Sure.
the next event at that point. But I'll ask them together. So the first one is, can you teach animals to do things like humans? And they specifically talked about manners. Like, can you teach your pet manners? And the other question was, is there a type of any bad dog foods that you should look out for and not feed your dog?
Well, I'll start with the first question. You can absolutely teach your pet manners, right? So for the most part, we'll look at dogs first, right? We teach them to sit, we teach them to lay down, we teach them to stay. Those are all manners. We teach them not to jump up on you. So they absolutely can train your dogs to have manners. Even cats. Cats, people always say, oh, they're too stubborn to learn. Well, yeah, because they think, dogs, they're like, oh, I love my human. Cats are like, the human's my slave kind of a thing. But you can teach cats. I have taught my cats because they want treats all the time. Well, they're going to work for it. So my cats will sit, they'll spin, they'll, sit up and beg. So absolutely, you can teach them manners. You can teach them tricks. As for dog food, I'm going to say, there's so many brands out there. But as long as you purchase a food that's from a reputable company, and what you want to look for is that they are what's called AAFCO, it's AAFCO approved. That means at least it's gone through, to get that label, it has to come up to a certain amount of standards. So if you don't see that on a label, that it's AAFCO approved, I would stay away from it.
And the best companies are the ones that have a veterinarian on staff to make sure that the food is formulated correctly for that animal. I will also say there's a lot of talk about grain-free diets right now for dogs. There is research happening about whether or not it can be dangerous to dogs' hearts if they don't have grain-free. There are very specific circumstances where a pet may need to be grain-free or a dog may need to be grain-free, but that should be determined by a veterinarian. So just kind of follow the advice of your veterinarian for what you should feed your pet. But as Tara said, the AAFCO certification is probably one of the most important things.
All right. Well, thank you both so much. This is very informative.
Thank you.
And with that, everyone, there's another session starting at 11:15 for those of you who haven't jumped into the brain break. So you have about 5 minutes before that session starts. And you can access that by clicking on Show Agenda and scroll down to the next session.
Wonderful. Thank you guys so much.